Let's now focus on the caudal views. Caudal projections are obtained when the image intensifier, or the II, rotates around the patient towards their feet. Here the II is rotating from an LAO-caudal to an RAO-caudal position. Let's again take a look at some real patient examples. If we start in RAO-caudal, in contrast to the cranial views, the circ is front and center. The LAD is located to the right of the circ. And remember, when I say to the right, I don't mean to the patient's right, I mean to the right of the screen. In AP caudal, the circ shifts slightly, as does the LAD, but their relationship stays the same. And then finally, in LAO caudal or spider, the circumflex shifts again, as does the LAD. Keep in mind that for LAO caudal, depending upon the patient's anatomy, sometimes the LAD can look like it's coming straight upwards. Let's look at this video that was obtained when the II was rotating from an LAO caudal to an RAO caudal position. We can see that in LAO caudal, the circ is located towards the bottom, the LAD is towards the top of the screen, and we can see their relationship stays the same as the II rotates to RAO caudal, where the circumflex ends up in the bottom left of the screen and the LAD ends up in the top right. Finally, let's go over some key differences between cranial and caudal projections. I'd like to actually introduce a little mnemonic that I use to remember some of the key differences. The mnemonic basically involves the 3 L's, which stand for LAD, LAO, cranial, and left. In other words, in the LAO cranial projection, I know that the LAD, in relationship to the circ, is actually the leftmost of the 2 vessels. And when I say left, again, I want to reiterate that I'm not talking about to the patient's left, I'm talking about to the left of our screen. I can then use this mnemonic to work backwards and know exactly what's going on in the caudal views, because the caudal is just the opposite. So in other words, in an RAO caudal position, I know that the circumflex in relation to the LAD is actually the leftmost vessel on the screen. Again, remember that in caudal views, the circumflex is the vessel that is easier to see, whereas in the cranial views, the LAD is the vessel that is easier to see. Use these tips and tricks to navigate through the rest of the site.